So my name is Chris Carrigan. I'm the head of the National Cancer Intelligence Network, the NCIN. And my role in around the cancer services is to utilise the data and information that we get provided through from patients as part of their care. So one of the benefits of being part of an NHS is it generates, as a unit, huge amounts of data and information as people go through referral and diagnosis and treatment, and indeed their outcomes and their experience. And within this country, we're fortunate to be able to link those data together and work with charities and with patients to begin to expose what the data says. So things that are important to commissioners, to policymakers, and indeed to patients. We're able to do that in this country to a far greater extent than anybody else in the world. We can produce, as a national network, national information, national comparisons about differences in whereabouts in the country people get cancer. For those who do get cancer, how do they fare in terms of their outcomes, their experience, their care? And how does that differ? And using that information is really important. And the way you use it most effectively is to work in those localities. So national information, national comparisons are good. It shows where variations exist. And then the importance of events like this and working with organisations such as Yorkshire Cancer Research enable us to use that information in a much more local facing fashion to begin to change behaviour, to change the way clinical practice gets delivered, to not just expose where the variations are, good and bad variations, to begin to learn from them and implement changes on the ground in local hospitals, in local practices, in local units, in local communities. And that's the most important thing, to begin to change and improve outcomes, experience and care for all cancer patients, and in this case within Yorkshire. Could be. I think the objectives for the day are very wide-ranging, and part of that problem is you suddenly become too unfocused on particular things. So we have two things. We look at the wide-ranging problems, and the day is beginning to expose some of those, but we equally need to look at some real practical things that can be done to improve things. So the wide-ranging problems, we know where the areas of Yorkshire are, where we have poor access to diagnoses. We know where the uptake to cancer screening is high and where it's low. And what we're trying to expose today is why, not just where the areas of low uptake to screening are, but why is that? Is it to do with different parts of the region? Is it a type of person? Is it the way that the local GP practices are operating? So we're trying to expose some of those things and look at how working with much more local based functions, we can learn from those and actually begin to put improvements. There's a stark contrast between lots of different indicators. We have lots of measures of the NHS, but if you took access to cancer screening for breast screening, for instance, it's a standard nationalised service. It should be the same for all, and yet we see huge variations across Yorkshire in terms of uptake to the screening services. And screening is good. Screening finds cancers early. Screening prevents cancers in the first place in some areas. So screening is a good thing, and yet we're seeing huge variation across Yorkshire in basic uptake to screening. And what we need to do is work with YCR and with local communities on the ground to understand why that is and what needs to be done about it. Is it to do with making things available in accessible formats, in different languages? Do we need to approach the community in different ways rather than just the traditional, here's a leaflet in your GP practice? Those things can only be done on the ground with the understanding of the local community, and that's very, very localised to different parts of Yorkshire. Information overload. We've got information overload in our homes. The amount of information that gets thrown at us, and particularly younger people, day in, is huge. And trying to sift and understand what the most important parts of that information are in terms of how you live your life and what decisions you make is really important, and it's becoming more complicated. What is clear though is that the public trust charities, the public trust people, patients trust patients. So the government has a particular role in this for campaigns and public health, but more and more of this pushes down to local communities and local intelligence and local relationships. That's where you begin to see effects being made which have a big impact on a national scale. So events such as this that Yorkshire Cancer Research are organising is particularly important because it focuses on what can be done locally using the information and intelligence we have at a national level. And that's the way we improve care, outcomes and the lives of people in Yorkshire.